Accu-Tell Chlamydia Cassette. Extract the chlamydia antigen according to the specimen type. For female cervical or male urethral swab specimen, hold the reagent 1 bottle vertically and add 5 drops of reagent 1 to the extraction tube. Immediately insert the swab, compress the bottom of tube, and rotate swab 15 times. Let stand for 2 minutes. Hold the reagent 2 bottle vertically, add 6 drops of reagent 2 to the extraction tube. The solution would turn turbid. Compress the bottle of tube and rotate the swab 15 times until the solution turns clear with a slight green or blue tint. If the swab is bloody, the color will turn yellow or brown. Let stand 1 minute. Press the swab against the side of tube and withdraw the swab while squeezing the tube. Keep as much liquid in the tube as possible. Fit the dropper tip on top of extraction tube. For male urine specimens, hold the reagent 2 bottle vertically and add 6 drops of reagent 2 to the urine pellet in the centrifuge tube. Then shake the tube vigorously until the suspension is homogeneous. Transfer all the solution in the centrifuge tube to an extraction tube. Let stand for 1 minute. Hold the reagent 1 bottle upright and add 5 drops of reagent 1 to the extraction tube. Vertex or tap the bottom of the tube to mix the solution. Let stand for 2 minutes. Fit the dropper tip on top of the extraction tube. Remove the test cassette from the seal pouch. Add 3 full drops of the extracted solution to the specimen well of the test cassette, then start the timer. Wait for the color to appear. Read the result at 10 minutes. Do not interpret the result after 20 minutes. Interpretation of results. Positive, 2 lines appear. Any shade of color in the test line region, T, should be considered positive. Negative, 1 colored line appears in the control line region, C. No line appears in the test line region, T. Invalid, control line fails to appear.